Welcome back to MidPoint, everybody. Once again, we want to take you to Ferguson, Missouri. That is where we are now watching. This is a live shot from Ferguson. The parents of Michael Brown are scheduled to make their first public statements since the grand jury findings of Monday night. We are monitoring the situation. We'll bring it to you just as soon as someone takes the podium. Now, let us continue. Millions of seniors across America will not give thanks this holiday season for a lot of reasons. One of them, looking at their 2015 medical coverage and getting yet another shock from the government over health care. This while a story breaks about how the Medicare system is, as we've always known, rife with fraud and graft. Welcome back to MidPoint. The Newsmax deputy health editor and captain of the company tennis team, Nick Tate, joins us here on the set. I had to throw that in there knowing that it's you, the big guy. It's okay, just making sure. This is, as I said, this is no reason to give thanks now because seniors who live on fixed incomes are now finding out, shock if you will, wait until 2015, the Medicare costs are going up, and we're not just talking about a couple of pennies here.
No, we're not. In some cases, it'll be a doubling in the copays for those Medicare Part D prescription plans. You know, for years, the Medicare program was offered a safe haven for seniors to protect them from rising drug costs, rising healthcare costs, but no more. As we see the number of Americans who qualify and become eligible for Medicare growing by about 10,000 a day in this country, people turn 65, and the dollars for Medicare are going down in part because of Obamacare and cuts that the federal government is making. We're seeing more people pick up the difference, and that's costing them more.
Are they trying to drive people to other plans?
Well, the truth is with seniors, there really isn't much alternative. Unless you go with a private plan, you pay out of pocket, which is going to cost a lot more. There really is no alternative. Now, the good news is that for many seniors who take the time to investigate what their options are, there are cost-saving drug plans and cost-saving Medicare Advantage plans, but you have to compare and contrast. You can't simply re-up the health care plan that you have this year, or you'll end up paying $50 to $100 more a month, which obviously adds up to a lot of money.
Now, what I'm reading here is the plan finder you talked about. They have to go to Medicare.gov and then they have to look. But aren't you still just looking for the right plan, the right money, the right deductible?
Yes.
So you're still basically playing a balancing game here to decide what you can afford and what you can't at the front end and at the back end.
It's enormously complicated. It's not just the premiums, it's not just the copays, it's what drugs are on those plans, what drugs are covered. This plan finder that you can find at Medicare.gov allows you to plug in information, what drugs you take, other aspects of your health care, and it will kick out a series of plans that are good options for you to consider. But the truth is there are other things you can do to hold down costs for drugs in particular. Consider generic drugs. That's one option. The average physician in this country gets about 21,000 free samples from drug companies. Just ask your doctor if he can offer you free samples. Pill splitting, ask your doctor to give you a higher milligram dosage for your prescriptions and cut those pills in half. You can do that in some cases and it's appropriate, but you got to talk to your doctor first. And then finally, there are, for those people who need it, drug assistance programs where you can get low-cost or no-cost drug.
How much of what is happening here with this plan and with Medicare is directly relatable to the Affordable Health Care Act?
A lot of it is indirectly related to the Affordable Health Care Act. The Affordable Health Care Act costs insurers, doctors, drug companies more in terms of taxes. They have to hit higher standards, and as a result, it costs them more money. And there's nothing in the Affordable Care Act that restricts insurers and companies from not passing those increased costs on to consumers in the form of higher premiums. So that's where the connection is.
When we talk about costs and we talk about money, it's interesting that we're here discussing this, and the story comes out this morning in the New York Daily News that the Staten Island cancer doctor who treated George Harrison, the former Beatle, is now going to pay $2.5 million for bogus Medicare billings related to his oncology practice. This is just, and I hate to use it, that tip of the iceberg scenario here, but Medicare fraud, the bogus billings, it's got to be $1 trillion industry out there that we just can't get our hands on.
It's huge, and in fact, if they could rein in those dollars and rein in these doctors who are taking advantage of the program, those cost savings would be clear to the seniors who are now paying more. This is Dr. Gilles Lederman. You may remember he was the guy who had George Harrison sign a guitar on his deathbed when he was dying of cancer. He was George Harrison's cancer doctor, and there were lots of questions raised about him then putting his own personal interests ahead of the interests of, perhaps his most famous patient. But this new suit alleges that there were millions of dollars that he scammed between 1996 and 2003, potentially involving thousands of patients that were not getting either the care they needed or that he was overcharging.
Simple word, despicable.
It absolutely is.
We'll
Absolutely.
take it from there. Let's spin, if we will, to now, out of the 3,000, I think it was 3,100 or something like this, the number of regulations now that the Obama administration has put into effect just before Thanksgiving. The FDA ones are getting the most attention right here.
Right.
I think this is actually a great idea. Any place you go, you're going to see your food labeled, calorie, fat count. I think it's about time Americans knew what they were ingesting when they go out to eat.
Well, you know, I kind of agree with you. I do think on some level that telling people what they're eating and the calorie counts makes sense, whether you're in the supermarket, whether you're at a restaurant, or indeed, in this case, at movie theaters. Your popcorn will come with a label now to tell you exactly what you're eating. My concern about this law is, are we really helping people? For instance, a single Coke or a soda, 250 calories. Do you know how you have to do to burn those calories off? Most people don't.
Most people have no idea.
It's about 50 minutes of running to burn off the calories in a single soda.
For one soda.
Now, if we put that information on a menu, we might get change. But this is maybe a first step in that direction.
You couldn't put that on the menu because isn't the whole idea here to scare people? Let's just be real honest.
Sure.
We're an obese nation. We get fatter every single day. Children are suffering from diabetes at much younger ages here. Doesn't this basically say, look, take a break and just decide what you're eating here? So I don't see it all that intrusive, but I think we should be scaring people because they'll never try to find out what it takes to get rid of that Coke.
Maybe so, and you know, that's the upside of this law, is that you're giving people more information. The question is, will they actually use it and make some changes? I've maintained for a while that if you could get a lower health care premium for losing weight, for going on Weight Watchers, for eating a healthy diet,
I like that.
That would really drive change in this country where, you know, we're all about information, we're all about helping people live better, live longer. This is one more piece of information that will give them that. There are some concerns it's a little bit of overreach and it's moving in the opposite direction of actually driving change, but at least they're giving people more information at the restaurants and the movie theaters and the supermarkets.
All right, I appreciate your time. Nick, thanks so much for being here. We do want to point out here that we are monitoring what is happening in Ferguson, Missouri. Guys, I know that we have the live shot here. Are we able to go to this live now? Here we go, live from Ferguson.
Along with my co-counsel, Attorney Anthony Gray, and Attorney Darrell Parks, and Attorney Pam Means, President of the National Bar Association. We will initially address this press conference, the family's response to the announcement by the prosecutor yesterday. Reverend Al Sharpton and Michael Brown Sr. will come and address you after the attorneys make their comments. Michael Brown Sr. will say very little because he doesn't want to misspeak because of such emotions that are going through him that will later be held against him. And so with that said, we will take a few questions after that agenda is completed, and we will try to respect the family of Michael Brown Jr. in this most terrible, unforgiving hour that they are facing.
That is a live picture from Ferguson, Missouri. That is the attorney for the Michael Brown family. You see Al Sharpton standing there in the background. The parents, as you have indicated, as he has indicated, the father will say very little. We are going to continue to monitor this press conference as the parents of Michael Brown make their first public statement after the grand jury findings of Monday night. We'll take a break and back right here on MidPoint.